I will call this meeting to order at 5:30. And Mary, do we have a quorum? Yes, we do. How about I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Lord Jesus, we thank you so much that we come together to have this business community. Our lives and help us to be more glory to you. In your name I pray, for Lord Jesus Christ. Amen.
Amen.
I did it. So you got the extra.
Thanks for having me.
Okay, so do we have any additions or changes to the agenda? And we usually have visitor comments.
Yeah,
Is that okay?
always,
Move that?
it's always been.
Got a whole agenda.
Yes.
It always
And
throws
I
me
didn't
off.
catch it when I was looking at it. So we'll do visitor comments after we get the additions and changes to it. So if we can change the visitor comments up there.
Yep.
After the
After the Pledge of Allegiance?
After
the addition.
Well, since we're already on number 4, let's move it to right.
I was saying.
Yes.
Make sure it's corrected for next.
And I wanted to add to the agenda, which is talk about Tony had some training days. We want to talk about that some, and then we talk about the whole policy about passing on that. So let's add the interim policy.
She's talking about me.
Yes, I'm talking about you. I don't know how to say it politely.
That'll work. Where are you adding it?
Probably just right after manor report. Okay. And the same, and that's where we'll add the training. Is there something else we can do? You're more regular than visitors. Yeah, exactly. She's not planning on attending, and I said that I thought that was good that she should be with her family and generally be with them, not be distracted by us.
Can we talk about the
We already did that.
All right, so we owe you some money.
So probably I need a motion to. Okay, so did everybody have a chance to read the minutes?
I did.
Did you?
I do have a question.
Okay.
So we have 2 or 3 items that we motion. One of those was about accepting the donation. So my question, and maybe my memory is during finance committee, that Tish had said, talked about.
Just so you know, the mic down at that end is really bad. I don't know if Carrie can hear, but it's cutting out every other word for me.
I can hear almost nothing.
Maybe we should get different
Just
speakers.
switch them out because we don't do much talking. We shouldn't do much talking.
Maybe even leave that one unplugged. See if it fixes it. We don't hear anything yet.
No.
There. Oh, that was you, Carrie.
I can hear you, Allison.
Better?
I think so.
Hello? Okay, good.
Oh, okay.
Yeah,
now-
that's a lot better. Thank you.
Yes, much better. Thank you.
All the problems of life were so easily solved.
All right.
Good job. Thank you, Kim, for leading us.
Right. So we approved the receipt of the very kind and generous donation and the use of it. I thought, Tish, you talked about buying the CT machine in the past tense.
No,
Did we buy the CT
well,
machine?
we're still in the process.
Okay.
We've signed the required paperwork and we've signed tentative financials because we could put it out. So it was just to secure the interest rate if we in fact had to get a loan for the balance of it, but we just signed the paperwork to get the order process.
As I understood that basically we're gonna raise some money, the rest of that money. from
That's
the
what our
community.
anticipation was for. This was just a fail-safe.
Okay.
Just in the event we couldn't. And it was just to lock in the interest rate, but not the amount of the loan.
Okay.
We could do without it completely and it wouldn't hurt us at all. We could utilize the full funds, which would be the difference between the purchase price and what we have, which is $313,000.
And so what was it?
Almost 500,000. Not quite.
That's what I was thinking, what they had given was more than what they raised.
Oh, much more, yes, much more. And all this did was secure the interest rate because the interest rates were going up. After the end of the prior month, we had to sign and commit so we could get that interest rate. Even if we do the loan 6 months from now, we still have that interest rate.
Do we have to do the loan?
No, we don't. It was
Okay.
just a
Okay.
we couldn't raise, let's say we needed 200,000, we could only raise 150,000, then we could borrow 100, we could borrow the balance of that at the lower interest rate.
So have we borrowed or not?
We've signed the paperwork to place the order. So in essence, yes, but we haven't parted with any money.
Okay. I just wanted to make sure we got whatever proper approvals, down in our minutes.
The last meeting.
Because I knew we had approved accepting the donation, but when you made the comment about like maybe something else had happened, I just wanted to make sure we, as a board, have gotten whatever approval that would be necessary, documented in our minutes. So that was my thought. So the minutes are right up here on this screen. So I'm referring to where we,
It's just right there.
yeah.
This one. Right there. Okay, so that's how we have it in the minutes.
so
How do the rest of you guys? Like, I felt,
I'm fuzzy, honestly. Well, I mean, I'm happy with whatever happened,
like,
but
in my mind, I thought we were moving forward.
right. I just want to make sure our minutes
Yeah, I just don't think the
match.
minutes reflect.
Right.
So
Yeah.
how do you want me to change the minute?
Oh, Carrie wants to say something.
Oh, Carrie, go ahead. Thank you.
So that was the motion that was made, and I don't know if I don't think the minutes need to be changed. However, Tish, if the CAT scanner is purchased, it would still have to come before the board, and we would still have to make a motion and approve the purchase of the machine, regardless of if it's paid for us or a donor. That would still have to come before the board. So while it's wonderful that you've moved forward with getting everything in place and you can give the board all the details, I do believe that you would still have to come before the board with the actual purchase. Nathan, are we on the same page with that?
It's typical, when we bought the packaging machine, that's
That's how
was
we've done it.
typical. And so I just same page and
So my understanding was that we had said, move ahead with it. But generally speaking, in the past, how it's happened is it came back and we've said,
We
Yeah,
would have lost
finish
the
the
price
deal.
and we would have lost the interest rate.
right.
So that was the only reason we did that, based on the fact that you approved to accept the donation. So we would have, if we hadn't have locked it in, and they told us, point blank, we asked several different ways, that if we didn't sign the paper, we can always cancel
Right.
with no cancellation fees. We will not be held responsible for anything. But if we wanted to lock in the price, we had to sign something. And so, yeah, it's a little bit by being held hostage, but I understand that we built so many machines, and if we weren't gonna at least pretend we were gonna order, they were gonna move on to somebody else. You need now, or is it maybe later in the?
We need
Yeah.
to not.
let me think about it. But when did you find out that there was this kind of, oh no, we need to sign something? Was that after our meeting that happened?
Yes.
Oh,
It
okay.
was.
Okay.
The discussion happened that, because I do remember the discussion about, I'm not sure where it happened, about dealing.
Yeah.
You were dealing, trying to
Yeah.
negotiate.
Yeah.
Right.
And
A better
I think
price.
that was in the meeting.
Right, I do recall those details being given, and if we got a good deal, I'm happy about it. But we do need to follow the process.
I don't remember that part of the discussion in the
general meeting.
So,
Right, that's right. We would be, but some details were provided on the topic, and but I didn't remember hearing, can we go ahead with it? And I don't want you to undo something that's been done, but just for going forward, that would be good.
okay.
And
Madam Chair, can you hear me? I can't hear anything on your end. Can you hear me?
yes, we can hear you.
We can hear you, Allison.
Okay, I would recommend that if you want to, you should ratify the actions taken to help with your potential future audit.
Right.
Thank
And
you, Allison.
that was my concern. If an action was taken, if we need to authorize it, we need to authorize it, even if it's fact.
Okay, thank you, Allison.
So Allison, do you recommend we do that as an amendment to the minutes that we have, or we do that in
No,
the minutes? from
I
this
would
meeting?
suggest that in this meeting, if the board chooses to approve the actions taken, that it ratify them in this meeting.
We'll talk about it during finance.
Okay.
So, any more questions on the minutes? So, can we get those approved?
I move we accept the minutes as they are currently written.
Second. All of those in favor say aye.
Aye.
I don't think we actually voted on the agenda either. Did we actually vote?
We did. Have we voted?
Okay.
Did you second?
We did, yeah.
Agenda?
Okay, very good. Okay, are we ready? We are ready for, are you ready for quality, Kim?
I'll be pretty quick again tonight. I don't have any med staff credentialing, and med staff didn't meet last month because of the holiday. Quality, we met yesterday. So on our ED wait times, our decisions to departure and our arrival to discharge times are meeting our expectations, but we're still seeing a critical rate of burnout. See how we can better fit our needs on getting our patients out. Shannon's on the committee, and she did say that sometimes if they'll respond to treatment, and so sometimes that might affect.
What are these? Why are we collecting these metrics?
Just to track and see how the
That
Who sets,
somebody or
who sets those
So it's
metrics?
a CMS requirement.
Okay.
So it's an OP18, I think, measure.
Okay.
So I have to quarterly put all of our transfers into what's called cart abstracting, and then
Well, now we were doing very good.
right,
And
been
it's
pretty
gotten
critical.
improved. It's gotten, we've improved.
Yeah. Overall, it's improved, and so we're trying to work with maybe get another bus here in town or rearrange people a little bit sooner so we can get patients out sooner. It's not cost effective.
I thought Shannon made a really good point there too, though. I mean, sometimes with an extra hour, they turn the corner and you can either admit them here or discharge them, and they don't, so I don't know.
Kind of catch-22.
Yeah, it's a little bit, the goal seems good overall, but there might be caveats to that for sure, so.
I mean, it would be nice to keep as many as we can here, so Shannon keeping them a little bit longer makes sense to see maybe we can
Sure.
patients here local.
And as a patient though, when you know that you're going somewhere else, it's annoying to have to wait. But when you, because at least from my perspective, I'd rather stay if you two.
Right, if you have a chance to stay.
Transfers are
Right.
very.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
Expensive for people.
Yeah.
And if you didn't need to go,
Yeah, and could just
But if it's
extra hours.
obvious that you've gotta get to Rapid or Gillette or Casper, then let's, you know,
Yeah.
out the door. Yeah.
Well, can you tell me again what ER times are meeting the metrics?
So the ones that are meeting are the decision to departure, so the providers decided that they're gonna transfer, and then the arrival to discharge from the ED, so that's just anybody coming in and not being necessarily transferred.
Okay.
It's also working on patient wristbands, making sure that all the patients have wristbands on, just for patient safety reasons. She had a 62% compliance rate of patients in the ER, and a lot of that reason is the wristband printer is up at the nurse's station, and so they have to print it up at the nurse's station. Somebody either has to walk up or walk down to go take it to them. She talked about maybe so now they've decided that they'll just take them down to all the ER patients.
They'll just be speeder.
Yeah.
Here.
I actually wondered if that's something we could see, check a price on, that maybe the foundation would, like, we could have another one? Potentially, one for the ER and one, you know, I mean,
I
maybe,
don't know how much they are, but
yeah,
something we could have.
Might be.
Yeah.
That would be
Something
great
foundation.
because then you're committed to ER.
right, it would solve.
It would solve a lot of, okay, I put an ace Band-Aid on, but I need to write that down someplace.
right, that's right.
And as the hospital, we don't need to spend, I mean, really having one is sufficient, but if the foundation wanted to get one, it would be.
Right, that's more, like you said, it's not an essential
It's a
item, it's a
luxury.
want, not a need,
Yeah.
but it might
It
be.
would increase patient safety.
I can see that happening too. I think that was a great suggestion.
I might look into that a little bit more and see if we could figure out what the cost would be, and then I can take it to the foundation. We're meeting next month too, so. Oh, sorry, next week, not next month.
I'll just kind of briefly touch on the manor. There's been about a 50% reduction in charted behaviors. 50% of the staff still need to do education on behaviors dementia training.
Sorry to stop. There's been a 50% reduction in charted behavior. What is that?
So what was it last month? There's like 400 and some charted behaviors where employees
Are these
charted.
good, positive behaviors or?
Usually it's an acting out sort of
Yeah,
thing.
so we're triggering high-end behaviors affecting others, residents affecting others. So that's where we started focusing on that. We found that we had some patterns with some staff behaviors that we started addressing.
So these are the behaviors of the staff that are being
Of the
tracked.
residents.
Of the residents.
Does that mean that, so you say 50? Does that mean that they are not being charged, or does that mean that that's not happening? Oh, that's nice.
They're happier.
Yes.
Well, they've been doing some
some
staff training. Yeah, they've been doing some staff training, so.
Yeah.
Very good.
Lisa's been working on Medicaid billing. 5 of the 9 billing issues that she had have been resolved. So that was good. And then our falls with major injury. Denise Weiss is working on that, and it's called an after reports. It's a metric. It went down from 85 from 88. We should see about that. Implemented a daily or any kind of incident to go over and review that. We can present it.
I heard you say Lisa is working on Medicaid billing, something.
We have some of our Medicare billing issues with the state. The state's not-
Medicare or Medicaid?
Medicaid,
Medicaid, okay.
and the state's not getting back timely for us to get paid. So
Okay, and you said 5 of 9 are
yeah,
improving?
and resolved.
Oh, and resolved, okay.
So during Judd's tenure, we were having trouble with Medicaid, and Alan talked to them and they did their thing. So if they give you trouble, I would talk to JD and have him talk to you. Yep.
And Shana, is that typical that we would have those sorts of?
Not really to the state. Short staff. Almost last week, there was full staff, so I'm getting to safe.
Home health, Heather's been working on notifying patients when there's been a December, but the main there are 94 completed annual reviews. HR has 51 reviews that they've received and then 54 that they've not received. And then there's 93 job descriptions that are signed, but there's 94 outstanding job descriptions. So Hannah said she's progress next month, within a month, to get more job descriptions back. And then she said annual reviews may take a little bit longer just because of our PRN employees. They work so infrequently that trying to catch them all in a timely manner is going to be a little bit more time. Finances, she's doing just a lot. So she's working on processes in place for the billing office, working on processes for billing turnaround times, clean claims, and then she set a hard deadline of the 4th. HIM, so we currently have 217 open charts. 2 of the charts that are open are from providers that are no longer here, and one 2021. So she's just working on a process to. What do you do? We just have to do a chart review to see how close the chart is to being done, and then you can just sign it. We can have another provider sign it. And then radiology, picture wasn't there, but we talked about possibly the CT machine implementation for her. That's going to be a big undertaking for her project. So, months long implementation for us. So, and then just overtime hours, they've been down since last month, so that's good. Managers are getting it's where it needs to be. So, other than that, there's really
Yeah. 3 pages of notes, but I'm not kidding you. The speaker was so bad yesterday that I was just trying to follow what you were saying most of the time, honestly. I'm sure Tish had some more stuff of the business office stuff, but I'm assuming you're probably gonna and finances and et cetera, CFO. Okay.
Going through there and digging up, and if I may ask a question, if it can be answered at all. We've got quite a few overtime hours in acute ER OPs. We have December. Something that can be resolved.
I'm thinking maybe the holidays have a little bit of something to do.
That makes sense. That does make sense. Who's on, who's not, who's got it covered.
Yeah.
What about the long-term?
We had an employee leave very unexpectedly right before the holidays, so scramble trying to cover that. Activities, I guess that's all related to dietary. They couldn't dietary to that, so.
And I have a question. Is it cool for travelers to get overtime?
No, we shouldn't.
Here, help us track that we're not paying for it.
Just more for us to go, hey, we have these people working extra hours. We need to hire people.
It's regular pay,
Yep.
but it's extra, it's more hours. Wow, that's nice.
And I just touched on the big ones in there. Right. The holidays would have a lot to do with things.
That's because we're down management. Sure. Two design, one that was termed and one that went off on. So technically we're on 5. Departments.
Everybody know that JT's been
Expert.
Well, I heard he was a guru at it. You know, he was, you know.
I do think it's amazing that you are just helping where it needs to be done. And
Yeah.
I think that definitely should be recognized and appreciated for sure.
Don't let it get over.
Oh, I do have one, just kidding.
In that chart, the ones that are not being paid, overtime paid, they still count the overall hours, right? Okay, all right. So we're still down even with that.
It's nice that the overtime hours are moving on the downward trend.
Yes.
I'm sure that's not happening by accident. So good work, everybody.
I agree.
Do you have anything else to talk about? Okay, so Tish, we will see you.
All right. So do we want to talk about the resolution now, or the ratification of the signing of the purchase order for the CT?
Yeah, now that I've had, Carrie, can you hear me? Are you still here?
Unmute Gary.
Let's be on mute.
See, you're on
I
mute.
think you're on mute right now, Carrie.
You're on mute, Carrie.
We can't hear you, Carrie. You're gonna have to unmute. There you go.
Okay.
Sorry about that. I said I understand completely what Corinne was saying. It's very, very difficult to hear you. It sounds like you're all talking in a paper bag.
Okay,
So perhaps we might be able to invest in some better speakers.
Yeah.
But Nathan, I'll do my best to hear you.
a little bit of time to sort of think about it. I think if we could go back in time, just going forward, I think it would have been better to have called a special meeting if there was like a special deal and you wanted to sign these documents. I think it would have been better to just have a special meeting and talk it all through and let us all look at what's being planned. But I'm happy to ratify whatever was done, but just going forward, I think our involvement would be important. What do you think, Carrie?
So I agree with you, Nathan, and we do have a fiduciary duty as a board to approve any purchases, regardless of who pays for them, and that includes the donor donated the purchase of a piece of lab equipment too, I believe, right? And that should go before the board as well. So regardless of which account it comes out of, I think it still has to go through the approval process by the board. That's just my thoughts. I just ask respectfully what the rest of the board thinks.
To be honest with you, I kind of thought we did approve it. That's was my understanding. But I also see from the way we have it in the minutes, that really isn't the way it went, but I thought we did approve it, so.
I will agree with you. I was thinking the same way, although the minutes, I will agree. And I don't, not talking badly about the minutes.
No,
but
not at all.
But it was interpretation maybe.
No, I don't think that's how it was. I'm trying to remember, there was a purposeful reason why we made the motion the way we did. So I think the motion was correct.
I do too.
But when we were talking, we all, like, in the executive session,
Some details were provided.
So we probably should have maybe come out then and made a motion to actually purchase the machine.
A better motion.
That, something
More
clear
informed,
about the actual purchase of the machine, not just the donor,
I think
spending the donor
something
money.
got muddled.
Yeah.
right.
And because
We
I
must have gotten sidetracked on
yes,
what we should.
because I agree that Mary, the way it's written, that's how I remember it. And so I think your minutes are good. I just want to make sure that we, as Allison said, ratify officially, whatever
The actual
happened,
purchase
just so
and.
everything is on the
Well, I
up
think
and
we
up.
can address that with a motion.
Yeah.
Now, it's kind of,
Yeah.
not necessarily that, it has not been purchased.
No.
And it has not,
Right.
it just, said
So
we would like one.
I just have a question.
Yeah.
If she signed a piece of paper that says we get a better interest rate, but there's no commitment to buy that machine with what she signed, is that true?
That is correct.
So I guess my question is, isn't that her job to save the hospital money? And do we have to approve a signing of a paper with no commitment for that machine?
I would say no. I think she did fine with what she did, and now she would bring it to us and say, okay, here's what we want. We want to purchase this. This is what the interest rate I've gotten and whatever. I don't think really anything was wrong about what we did or what she did.
Right.
I would say.
I brought it up because in our finance committee meeting, as I remember, Tish talked about buying the CT machine in the past tense. And so I asked, I was like, why are you talking about having already purchased it? I didn't think we'd gone that far with it.
So
that
would mean we're not really ready yet to vote on this until we know the numbers exactly.
Right, yeah, we don't
Right,
want
so if
a
she-
motion until she explains to, sorry, I feel funny calling, anyway.
Right.
You can call me she.
She. I won't take offense.
Tish.
I just, until you really explain
Madam CFO.
what she did. I think it's a very good point, Mary.
Yes.
Very good.
Explain what you've done,
And then we make a motion and say we should move forward. We accept,
Right.
you
as
know.
long as it's something, the stuff that you need to tell us doesn't matter if the public knows.
Right.
And I wouldn't think, like, sometimes when you're dealing on things,
Yeah.
you have to, you gotta keep
We
it
did
quiet.
deal, and we came to a pretty good deal, so I think at this point, it would be appropriate to give you those figures as to what we agreed upon. Yes. So I can do that, and then I do that now.
Sure.
Okay. Wherever you want to do it in your, it doesn't matter, but while it's in my little pea brain, let's.
Carrie.
Yes, Mary.
So I don't think there was anything, I think Mary's minutes are great and that exactly what the motion was. But I think if you remember when we approved the motion, we didn't have the complete details on what the donor wanted and all of the details of his donation, that the chair and the CEO were going a week later or a couple days later after the meeting to meet with the donor. The motion was to allow the chair to negotiate, or not negotiate, but to talk with the donor and accept the terms that were being proposed. With the donor and accept the terms that were being proposed. So it was a first step and an instruction to the CEO and the chair to move forward with meeting with the donor. It wasn't the purchase of the equipment or whatever he wanted to donate was to come before the board down the line. I don't think Tish did anything wrong. I think that's wonderful what you did moving forward, Tish, to bring that information to the board and present, what the actual purchase price was. I think everything was done appropriately, I feel. And there was a timeline involved. So I think it's great that you moved forward with those, the purchase of the equipment that was talked about, and then that just needs to come before the board when it's actually purchased. I think we're all good with our timeline. Does that make sense?
Thank you, but what? Can you hear me?
Mm-hmm.
What you've showed, so that I figured out the problem. And that's, I did not tell you guys what happened in that meeting.
Oh.
Right, so I should have sent an email to all of you telling you what had happened in that meeting, and I failed. So that is where things dropped off. Yeah, except that it was a month ago and I don't remember.
Okay.
But that shows my confusion though about.
You had to get it put back together, right?
Right.
You got it straight now.
Yeah. So at that meeting with the donor, he wanted, so that's, we wanted to go ahead and purchase he gave the money straight up that we needed to purchase the
lab and the
lab. And then the money that was left, he wanted us to use for the CT machine, and then, which was the 300,000
and change.
And Keisha was working hard at getting the stuff down to a good deal.
Mm-hmm.
And so that was going to leave less than the 300,000 for us to raise. And I did, my understanding, like the loan had not crossed my mind. My understanding is that we would raise the rest from the team.
That's the plan.
And that it would go before the foundation, and that we would, go ahead, Carrie.
I think that's the piece that has to come before the board. And if I could speak for Nathan, I think that's what you're talking about, right? That if say the donor gives us 300,000 and the machine costs 500,000, what are we going to do about that other 200,000? That's the part that has to come before the board, and the board would have to decide. Does that make sense?
Actually, my point, because we approved accepting and using the donation, but I don't think the donation was large enough to buy both pieces of equipment. Not, I would guess, not anywhere close. Yeah.
Well, it's short that 200,000.
Right. And so my question was just around the part the donation won't cover.
Right.
That's exactly right. Locked in a great deal. I'm proud of you. Good job.
So what we did was we have a 5600 Veritas, which is I'm not quite sure what it does. Jim explained it, but he speaks lab. It's that big, it's that
One
big
that's the analyzer thing,
right?
right?
Yes. And so that is 182,000 and change. CT is 495,000. That includes $65,000 worth of free equipment that Keisha got for cardiac studies in the future. So that was at no price. She got them to throw that in because we were negotiating between Siemens and Philips. We ended up buying the Philips, or agreeing to at least purchase the Philips. Because it had a better footprint, it fit in our existing building. We weren't gonna have to do any construction. It was a smaller project. The only thing we will have to do is we will have to have a mobile unit come while they move the old CT out and the new CT in. We have tentative quotes, but nothing in writing on how much that machine is going to cost us to rent. And it's going to be a mobile, they'll just come and park it. And that is part of the package presentation for the complete purchase and installation of the project. So you have a complete, this is the equipment, this is the ancillary items that are needed. This is the total cost of the project. So we'll have some construction in progress, even though it's not really construction, it's just the project in transition. So we're going to go ahead and book it in construction in progress until it's done. The new CT is there, and then we'll go ahead and we'll put it to our fixed asset spreadsheet. So that's where we are price-wise. In order to get that and all the free goodies, we had to sign it by a specific date. Kathy was not available. We got the that was cool. And their code department sent me the paperwork to lock in the interest rate. Very clear, I have it on the writing that we are under no obligation for either the equipment or the loan. No harm, no foul. So we are in a position to, at this point, move forward. So at this point, we don't have anything in writing for you. Are you willing to make a motion, or are you able? Or do you want a written report?
I don't think a motion is necessary, because your core point is we've just exercised an option to do something in the future, but we don't have to do it. And so, I mean, no real decision to commit us to spend funds or borrow funds has been made.
So what we
Is that
need,
right?
we need the commitment. So maybe I'm wrong, but this is what what it feels like to me. We need to have the ability to start raising that $200,000. You really do that without having done what you did in getting the machine lined up.
Right.
So,
So moving forward is that, I think that's the motion I thought we had to make. I
right,
need a motion that we can move forward to actually get the order placed and to move forward in the process to make the purchase.
to make the
Yeah, that's
purchase.
what I think.
And
I mean,
That's what we make the
we're at that, right? I thought we were at that. And then raise, yeah.
But how would, go ahead, Ted.
The equipment that we are replacing, does it have a value?
It does, and we've been given value for it, which is part of our purchase price.
Okay, so
Like a
they're
trade-in.
taking, they're taking it as a trade-in.
As a trade-in.
Okay.
I didn't want it sitting in the basement.
Nope. Let's move on now.
So, can you tell me what the name of the 5600 was?
It's a Cardinal Veritas 5600, and I will get the spelling for you, because I'm a bad speller.
Veritas.
Yeah.
So,
Carrie, do you, oh, go ahead, Ben.
well, I was just gonna ask, so I guess I'm a little confused. If we really don't know where the extra 200K is gonna come from yet.
That's what we have to.
And they
But-
signed a borrowing thing
Right.
to kind of lay the groundwork to
Which
borrow
is
the money
fine.
if needed.
I don't know if we to me, it doesn't feel like we're ready to make a motion yet because, I mean, yes, to proceed forward with raising money, but you really can't make a motion on spending 200K until we know what the 200K is coming from.
So my question is there a time limit to this? When do we have to sign by and say, yes, we're
We
going
need to
forward?
be able to move forward, and their days are counting by the end of January.
Okay,
We need to, because we've locked in that price, but they're only willing to keep that price for so many days.
okay.
Probably get it extended, but at the present time, I haven't asked.
If we have money enough for the new CT scanner, why are we throwing in a Veritas?
Because that was they wanted to purchase the lab.
That was the donors.
That was the
specific
donors.
That was the donor's
Right.
request, that he wanted a new CT, or
And then,
they, not he.
yeah,
They wanted a new CT
Wanted the new lab
and
at
the new Veritas.
and then put the rest of the money towards
Well,
the
that
CT.
Veritas is the name of the CT scanner.
No, that's the lab
that's the
analyzer.
lab equipment. It's
Yeah.
an analyzer for the lab.
Right.
Oh,
Right.
okay.
And so we bought that outright.
So that,
With that.
Right.
That was the,
Right. And
you
then,
haven't bought it yet?
No.
Okay.
We've just kind of moved
But
towards.
you've agreed.
We have the funds for it.
Buy it.
Okay.
We've talked to Cardinal about it. We could issue them a purchase order and still pull back at any point.
Okay.
so I am totally
So
confused.
Veritas is the lab equipment. It's 182,000
Right.
and change.
Okay,
Lab.
yes.
So the CT is Philips, and
Right.
it's well, we're going to be using
That's your Bible.
313 and change
Okay,
of the $500,000 donation, which
Yeah.
leaves a loss or a
the 200,
of about shortage of 200,000.
so you have not finished off you have not signed the paperwork on that lab thing yet.
It's not a purchase. We just have to do the purchase order. We have to submit a purchase order for it, and then it'll be on its way.
Okay,
Right,
well,
well-
we need to get a motion done going on that for sure, because I think what's causing us the heartache is the loan piece on
Right.
the.
well, and my take on our minutes, which I think are excellent, and I like the new font, by the way, it's easier to read.
It is easier to read.
Is we approved both receiving the donation and using it. So as far as I'm concerned, we gave you the green light on
Okay.
the lab machine, right? It's just that with the CT machine, we have about half of the funding from the donation, which you have a green light to use that. But this part that's unfunded, and did I understand you correctly that whatever the great deal you worked out, it expires the end of this month?
I have to move forward
With the
the
CT.
CT.
So, Ann, was that on the agenda for us to like approve that or something? Or were we did we sign the papers and we were gonna lose it at the end of the month?
I don't know that I can get it extended. At some point, we have to make some forward momentum to get that purchase price. We agreed to purchase at that price, but we haven't committed
Right.
What we've done is we've kind of stood in the
Agreed
middle
on
of the road.
terms, but not signed the actual purchase.
Wouldn't it be fair to say then we should go ahead and approve borrowing the extra 200K and raise and then, because we're not gonna raise the funds between now and the end of the month.
Right.
Well, we don't have to pay for it until it's over.
Okay, so we have
And
the,
what
We
is,
just have to commit to buy it at that.
right, so in other words, we would vote and say the worst case scenario is we've got to borrow, you know what the interest rate is, by the way?
It's less than 6%.
So we have to commit to, at the worst case scenario, saying that we agree to borrowing 200K with 6% interest.
So can we do that with it not being?
ask,
Is it just part of the?
ask Allison that. Allison, can you hear us?
Yeah, can you repeat it? It's just hard to hear you guys.
Do you think, can we make a motion, about this CT scanner, without it being on the agenda?
Yes, because this is a regular meeting, not a special meeting, you can.
So it sounds like the motion, if we want to make it, would be to accept the terms that were agreed to with, was it directly with Phillips?
It was, yes.
Okay. And what was the term?
The life of the equipment.
Right. And so, I wouldn't want to lose the good pricing. So I think that's good. I am a little curious why we came into the meeting knowing that this deal would expire at the end of the month. We weren't going to talk about
My guess, well, so this is what I would guess why we came is because without this is maybe because of Kathy and not thinking about it, because in my mind, we had already done this, even though, and so
Okay.
that's on me. And then also Tish isn't quite used to how we are as a board yet.
it. Okay.
I'm like, would that be a fair guess as to why, I mean, if the rest of you guys agree that that's?
I truly thought, even, I didn't see the minutes, I don't see the minutes, it's not appropriate, I don't need to. Based on the notes I took, I thought we agreed to at least move forward.
We did.
Not spend the money, but to move forward, which is why we signed it.
But, and that's how you would get it and be able to come bring us the numbers, so we knew what we would sign off on for the balance anyway. So I think everything you did was appropriate.
I think it just is, honestly, it's me and Kathy why it's not.
Glad we sorted this all out, because it
Me
would have
too.
been a tragedy to lose a good deal.
Yeah, we would have actually had to reach out and contact you guys, and say, hey, what,
Special
a
meeting.
special meeting, because it wasn't brought forward. Yeah, I went on the assumption, bad word, but that we had
Which
gotten
is
permission.
good, because you move forward, and we need to move forward. So-
Carrie, do you know when you'll be back? Oh, your hand's up already.
Oh, sorry, Karen.
So if Tish is going to be, if this contract includes any type of financing or anything, well, I just called it a contract. It's a contract. Doesn't it have to be reviewed by Allison? And then isn't there a protocol for that, Allison?
So it's up to Kathy and the admin team what they have me review, but if they want me to review it, I would, and let them know if there's any issues before it's approved.
And Carrie, will you have enough time before the end of the month? When we bought the packaging machine, I thought you really helped us by negotiating a better interest rate with our local bank. Have any interest in doing that, or Tish, would that be too complicated for what we've already done?
No, because all we've done is we agreed to lock in the price. It's like when you purchase your home, you agree to lock in your interest rate for so many days so you can complete your purchase. It's kind of the same thing. It doesn't really obligate us. If we want to go to any local bank and say, hey, we'd really like to do business with you, and you know, this is what we need. What can you do for us?
Right. Well, we need the machine, and I'm glad you got a good deal. And I don't want to lose the good deal. But Carrie did, I think you saved us a couple percentage points.
Yeah,
with
we
the package.
did. We did well the last time using a local bank, and we were able to keep our business local. I'd be happy to reach out to First Northern and look at doing that again. I will be back on the 21st. Tish, does that give us enough time? Can I touch base with you then about the purchase prices and all of that, and then we can I can talk with the people at First Northern? Thank you.
So just to be clear, we signed it so it wouldn't expire in 30 days.
Right.
So
Yeah, that's fair.
we can always renege, but we wanted to move forward. That's what we do. So we ended up locking in the rate for the loan. A better rate, more power to you, because this is something that they just offer us because we're buying their equipment. It's like when you offer a really fun interest rate. So we can definitely shop around.
So, but also to be clear, the donor was he really did want us to work at raising the rest of the money from the
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
But to be clear as well, we're looking at purchasing a $500,000 piece of equipment. We have a commitment for $300,000. We still need to have a board decision on how to pay for the rest of it. That's fair.
So really the motion is, are we gonna purchase it or not? Can she move forward or not?
Well, really, the motion I've written is that we're approving Carrie and Tish to work together to obtain the financing to purchase the machine. So maybe we could have a motion to approve the purchase of the machine and also to approve the financing.
Because no matter what, we're gonna purchase it. The question is just gonna be how,
Right.
are we gonna finance or get
Well, I think
it?
the motion ought to be that we move ahead with the purchase of the machine and to look at fundraising and or financing
Yes.
the remainder of approximately $200,000.
I think we will oh, go ahead. Well, my reading of the minutes is.
Can we do one for each one?
Yeah, well, I think in our minutes, we said we approve receiving the donation and using it. So that covers
Let's
But okay, we
make
can
the
do that.
motion anyway.
So.
We'll go ahead and that way it'll be clear in our minutes
Right.
that we
Well,
And-
please help me
move
with the
forward
motion. I'm going to try
Yeah,
this. Madam Chair, I move that we purchase the two machines, the Veritas and the CT scanner with donation money. And to go ahead and look at fundraising. The additional $200,000 for the purchase of those two machines. And if not, but at the same
I think we should split them up.
Hey.
Let's just, I mean, that's,
Alright.
basically, that's what we want to say is all those things. Let's just do it.
One for each.
Almost three. One for purchasing the lab analyzer. One, and with the, because that's straight up. We don't have to worry about it. Then the CT, the loan and the borrowing and the fundraising.
Yeah, so-
Those might be able to.
So I jotted them down. So I think the first motion is to approve the purchase of both machines. And the second motion is to approve the new borrowing, pay for the CT machine. And then we'll try to do a fundraiser.
And one with
Future
separate
and-
motions for each machine. So that,
A separate motion.
and I think Ted has to withdraw his motion now.
I didn't get a second.
He didn't.
Oh, okay.
She didn't recognize my motion.
Okay.
It's gone.
So I did.
Alright, so Ted, do you mind if I give it a whirl or if you want?
Sure, I do it either or. It makes no difference.
I move we purchase the 600 Veritas Kim Analyzer pursuant to the terms negotiated by management.
All those in favor say aye.
Aye.
So can I get so it's the Philips CT, is that a good enough description?
Yep.
Okay. I move that we approve the purchase of the Philips CT machine pursuant to the terms negotiated by management.
A second.
All those in favor say aye.
Aye.
All those opposed, the same?
And for the third motion, Carrie, can you hear me okay?
Sometimes.
I move that we approve, that we give authorization for new borrowing to possible the purchase of the Philips CT machine, and that Carrie and Tish collaborate to get the best interest rate we can, whether it's with Philips or with our local bank or another lender.
And make an amendment to that.
What we should do is okay, so get that seconded and then,
Okay, I'll
Then we'll
second.
have
I'll
discussion.
second.
okay, now let's have a discussion. And so before you actually make the amendment, let's
Okay.
tell us what you're thinking.
My amendment would be to include, because to include fundraising before borrowing.
Yeah.
Because that is
Which
what
they might have to do talking about the borrowing, but the guy was very clear that he
He
wanted
wanted
us to
community
go to
support.
the community. So what I don't want to see is it to get out in the paper that we're borrowing however many hundreds of $1,000s and then
Right.
before we even start talking about fundraising.
fundraising. I agree. That would be my point too.
But the only reason I brought that up is when the verbal agreement was made, there was some borrowing. They want to know that we
Yeah.
can complete the purchase
Right.
before they're going to start building it and deliver it and so on and so forth. So we're going to hope to do our best effort to raise the funds.
Right.
But they're not going to start building the machine and
Until
on the
we have
promise
that.
that we can raise the funds from the community.
Right.
And is that?
I understand
So-
what you're saying, but I'm thinking that our benefactor is going to be looking for, well, they didn't even try. They are going to read the deal
I think
and say,
carries.
Yeah.
I'm gonna say, well, they didn't even try to raise the rest of the money. So somehow or another, I think that needs to be tied into that.
Yeah,
Right.
we can amend that.
I agree. So go ahead, Carrie.
So to both of your points too, what we also don't want to be doing is accepting a $300,000 donation and committing the hospital to another $300,000 worth of spending that we're not sure if we can do or not. So, while I think it may be premature to start building and purchasing a piece of equipment without trying to do the fundraising first, because what if we don't have the 200? I mean, sort of like the grant for the clinic. We were given $2.5 million, but then we would have had to come up with another $1 million, and which we couldn't do. So I think it might be premature to authorize a purchase when we haven't figured out how we're going to come up with the other 200,000. We don't want to obligate ourselves to another 200,000 of debt. Does that make sense?
I think that's what we need to decide in discussion, because if we say no to this, we're gonna lose the price that they've negotiated, the additional equipment and all of that. So we either have to decide that as a backup plan, we would obligate ourselves to that 282,000 specifically from the numbers I was noting
Kinda
down.
did that with our previous motion.
Right, we did.
Well, right. And Carrie, I think the ship may have sailed. The first two motions that we made, I hope you can hear us. I mean, we could change it if we want to, but the first two motions were to authorize the purchase of the chem analyzer and the CT machine. And if we want to go back and change that, we can. But now that we've taken that step, the Phillips isn't going to start building the machine unless they're sure we can pay for it, whether it's from fundraising or whatever. And I don't think they're probably flexible enough to say, we'll take half of it and we'll trust you guys to, your fundraiser will be successful. And so I think the financing is very much a backup plan, but it's what Phillips needs to begin building the machine. They need to know we can for sure pay for it, and the goal, and we don't have to incur any debt until the machine's delivered.
Right, we don't have to pay for it till it's delivered.
Right. And we're thinking the delivery will be several months away.
Yeah, when is the estimated delivery?
I don't have a definite date because I haven't pushed forward on anything else.
Right.
But we can get.
Are you thinking like summer or fall or?
I'm thinking between spring and summer.
Okay, so then we would try to fundraise in between now and then, because if we move ahead with it, we can start fundraising, and we would do our best to fundraise to try to cover the part not covered by the donor. And then if we fail in those efforts or we're not thoroughly successful, then the financing would be there for the rest.
So I think,
So it's a little hard to explain.
We have to be willing to borrow the complete amount if we have to.
Yeah.
Right, because Phillips needs that to build it.
We
And
have
they
to be
won't
willing to
build it unless we.
And am I correct that, so I think you said it was $495.
Yeah.
We have 313 left.
After we buy the analyzer.
So that's 182,000 that we would actually be
At the
committing.
time, they haven't added anything.
Okay.
And our maintenance agreement doesn't start for 2 years. We don't have to pay for the maintenance agreement for 2 years. It's with another. Yeah, that's a good word.
So I think we do have to decide if we're willing to commit to either $182,000 of additional debt if we don't get it covered. I'm guessing that we could get a partial coverage of it, but that's just a guess.
What are you gonna say here?
Could we make a motion to initiate a community fundraising campaign, a matching donation campaign for the CT scanner?
Ed is trying to do with his amendment,
Okay.
initiate a fundraising campaign, so Nathan made the motion to give you guys authority to look at borrowing, and Ted's trying to add to it that we need to initiate a fundraising campaign.
So could you say Nathan's motion to do the financing for any funds left over for after a community fundraising campaign? Is that what you're trying to do, Ted?
Yes, basically.
Okay.
I was just trying to get fundraising in there because that's what the donor wanted to hear. And
And money wise, that's what we need to do rather than borrow some more.
And we,
I'd be a whole lot. I would be a whole lot more comfortable with that than a flat out motion to finance.
I'm hearing two separate motions. So let's, oh, okay.
Your
You go ahead.
motion with an amendment.
Okay, so what's your amendment?
Well, I'm going to jump back to looking at the possibility or trying to raise funds for the needed approximately of $182,000 the CT scanner.
Okay, so the amendment is to initiate a fundraising, just stop me if I'm not right, to initiate a fundraising campaign for the CT scanner.
For the balance.
For the balance.
That would be better word. Approximately.
Yeah.
I don't know how to join it together with the.
Right, that's what I was thinking about too.
I know.
Two separate motions.
I think we kind of have to join it though. I mean, because for her to actually sign an order form, we have to have a backup plan.
Yeah.
We have to know that our bottom line is we are committing to either to paying for a loan for whatever part of it that isn't raised.
You can offer a substitute motion that simply says that,
Oh, you're awesome. Thank you. Vanilla ice cream, I'll be right back. Thank you. Thank you.
hit the goal, beyond the donor's donation for the CT scan. And simultaneously working, with local vendors and Phillips.
Okay, so let's draw your motion.
Yes.
And if Kareem is up to that.
I'll let.
If I'm up to it.
Were you the second?
Mhm.
Oh, yeah, sure, that's fine.
And then Nathan, word it like.
Like what JT just said.
I'm, go ahead, Mary.
You're having trouble.
So
Go ahead,
could
Mary.
we make it simpler and say,
Yes.
make a motion to initiate a campaign,
Mhm.
fundraising campaign. And if that campaign falls short of needed funds, then pursue additional financing by shopping for the best interests.
And you said, I think you should need to say simultaneously, while simultaneously looking for the best interest so that she can get busy.
I think it almost has to be the other way around though. I hate to say it because for us to give her the permission to go forward,
Right.
we have to say we're willing to borrow 182 to 200,000. We have to be able to agree to that. And then we'll try to supplement it with what?
While simultaneously.
Yes.
Doing the fundraiser.
So it's just this flip of what you just said, basically.
Okay. So
That's why I was thinking about two motions, because I'm having trouble putting it all together as one, honestly. Because we are, when the papers are signed by whoever, we have to give permission to, if necessary, to borrow those funds.
Right. So is everybody on board with that? If we raised $1, is everybody happy to spend, to sign on the dotted line for a loan of $182,000?
Go ahead.
Yes, but I think Phillips don't care where the money comes from. They're asking $495,000 for a machine. We're signing a contract that will give them $495,000.
And we'll borrow if necessary.
And we will borrow if necessary, correct. So I'm thinking that whether we borrow or fundraise or however, I just think for the donor that he needs to know that we're going to fundraise.
Right.
And or borrow, whatever it takes. And signing the contract is all Philip's worried about. They're not worried about how we're getting the money. We've signed the contract, they're gonna get $495,000.
Well, and we've already authorized the purchase of that in the
That's right.
previous motion that we passed.
So that part's done. All we gotta do is how we're going to make up the $182,000, either through fundraising or borrowing.
So the next motion would be, we're gonna initiate a fundraising campaign.
Right, right. So that was my next motion,
Okay.
if
Okay,
you
so-
don't mind.
Okay, so I don't know where we're at as
So
far as
I'm gonna-
Robert's rules.
I don't think we need to take back the motion that was
Yeah.
already there.
Okay, so tell us again what your motion was.
When we already voted on.
I know, just remind us.
I
so
thought we
when we're
already
voting.
withdrew that motion.
No,
We did.
Oh,
we were in discussion on that motion.
I asked
But we
you to
need to
withdraw.
remind ourselves what that motion was.
I didn't think it was formally withdrawn.
I don't think so, because, but have you got it all, can you unscribble it?
I'll just rewrite it, but I'm gonna need some help with this.
Okay,
Because I'm really confused. I'm sorry.
okay, Mary's,
They've gone around a couple times.
I just want to get it right, and I don't think it's right.
okay, so read what you've got.
Okay, I have a motion made by Nathan to purchase the 5600 Veritas chemical or chem analyzer. Benjamin seconded. No discussion, motion passed.
Yep, and that is correct. That is right.
Right, so
Okay,
Wait, then she
but
has another
you
one.
had something else in there pursuant to,
No,
Right,
that
so-
was the next one. That was the next
So
one.
we
Second.
made two motions.
yeah, and the next
And-
motion I have is Nathan made a motion to purchase the Philips CT scanner pursuant to arrangements,
To the terms negotiated by management.
pursuant to terms.
And I think I've succeeded in making our combined motion.
Stated
By
By
management.
by management.
I
And you
seconded
seconded.
that and we voted and it passed.
Right.
And then I have withdraw because I think I've written a combined motion that addresses everything that's superior.
And then Ted is gonna make a motion
Oh, okay.
that we initiate.
Well,
Can-
I will withdraw my amendment, it hasn't been voted on.
Okay.
If Nathan, I guess, if it's okay with you're wanting to withdraw your original
Just
motion to make it a
withdraw the
little.
motion. And I think I have a better.
Is it all right with the second?
Oh, you've got one written down.
Yes.
Okay.
And
Oh,
then-
okay.
And then
Sure.
start over with a new motion.
Yep.
Right, so I'll just read my motion and I think
So your
it's,
new one?
I think
Okay.
I've got, so,
Are
the
you good,
motion,
Mary, so far? Okay.
the motion is as follows. I move we initiate a fundraising campaign for the unfunded balance of the CT machine, and we authorize the borrowing of any amount due for purchase of the CT machine not covered by the fundraising campaign.
Very good.
There
Yeah.
we go.
Very nice.
Yes, I made up a little bit as I went, but let me,
Let him fill in the blanks.
let me,
Okay, I'll second that. Okay, are we good to vote? Or do you want to finish? You got. it
I'll
written down?
I'll make my changes.
So let me think
Okay.
before we vote.
Yeah,
Mary,
so
this
we-
is recorded, just as,
So I can also send the link to you if you want.
The recording might be more confusing than what we did.
Yes.
What are you asking, Tish?
when you make your agreement, when you sign or send a purchase order, whatever the next step is, you're saying that all those funds are available and ready to go, basically, right? Isn't that? Okay. So my only question I have in that amendment or that motion is, No, I think that would cover it. Never mind. I think I just asked that. Okay. We go
So
forward.
do we have a second?
I seconded that.
Okay, I'm sorry. Of Nathan's.
Yes.
Okay.
Okay, so are you ready to vote then?
Okay. Everyone in Gary has any questions on that.
Are you good, Carrie?
Can you hear us? Okay.
Okay, so read it one more time before I call for the vote.
I move we initiate a fundraising campaign for the unfunded balance of the CT machine, and that we authorize the borrowing of any amount due to purchase the CT machine not covered by the fundraising campaign.
Okay, all those in favor say aye.
Aye.
All those opposed, the same? Okay, the motion is passed.
I need more coffee.
So can I have those, can I have your notes?
Yep.
So I can write it down?
Yep. I hope you could read my scribbles.
Okay, so do we? Here, take a quick break.
Sure.
And people can grab food and you can finish your CFO.
Oh, you really wanted to? Good.
Sorry.
Good luck around here.
No, I just,
Okay,
I
so
just
our-
want to get it right.
We're gonna
Yeah.
take a
I
quick
get really.
You're
We will
braver
be
than
back
I am
in
trying
a
to keep up with that, so I would be so confused.
Okay, now that I've. Carrie, we're gonna pause recording for this minute while we take a break. We aren't pausing. the-
No worries.
Are we ready to get started?
No, go ahead, go.
We will talk about it.
Well, you have a copy of the financials.
I have several comments.
Thank you. I was gonna ask you that in the break and I forgot. Thank you.
That was the HR add-on, the blue and white one, so.
Okay, so we all ready? Ready. So, I put the financials up
A week ago today in the SharePoint, did everybody, nobody had any problem following my instructions? So that's where I would like to be, simply because it's away from the general agenda and. So basically, it's the same, all the projects I've been working on since I got here. So I have a meeting with the auditors next week to go over the timing and the start of the. Can you hear me? Here.
I can hear you.
Over 18 acres, but sometimes I try and use it in site twice. So I have a meeting with them. I have their item list. They sent me of all the outstanding items of things that we would need to provide them. So we're going to go ahead and do that. As far as the data migration from Meditech into Sage, that is a quasi-manual process. So what we had to do is print out all the detailed trial balances. I have to put them into a form, and then we can upload the journal entries. I have 20 months to do that. It takes me approximately 8 hours per journal entry or per month to get them done. 20 months. I got a all. So what we've got is I have 5 hours of saved time left on the contract. I told him I didn't want to extend the contract. I just wanted to work within the parameters. He felt if we were both working on them, like if I look them. Can you hear me, Carrie? You're making a face.
Tish, can I ask a quick, so you said 20 entries, 8 hours per entry, so 160 hours, so basically a month.
That's a month. And between the two of us working on it, we're hoping we can get it done in 2 weeks. That was my goal. My goal was to have it done in 2 weeks.
I'd like to stress something there. So we're saying that that is a requirement only because it wasn't done properly.
It wasn't done at all.
The
in
first, when this was
implementation.
supposed to have occurred. Okay. I just want to make sure that that point is
Right.
clear.
In our contract, it was covered, but only if we did it
At time of
at
implementation.
time of implementation, and that did
So
not.
they would have just taken all of the data and put it over during the course of the implementation. I don't know why, Daniel didn't know why, there was no real documentation.
That was going to be my next question is, does anybody know why that didn't occur?
They made the
Because life was
decision
such
that
a
they
mess
could,
in the hospital.
that they could put it in at a later date, which they can, but nobody asked what the process was going to be to get that data from one software to the next. So I'm still shooting for January. It took me 8 hours to do the first one. I'm hoping the second, I'm hoping it speeds up because you have to do the net change for the balance sheet and the total expense for the month for the P&L. What drags it down is I have to, let's say salaries, and I have to do it by department. And we've got all these departments, otherwise we won't be able to have department detail. Which we want department detail. Now I can go back and do them later, but the auditors are gonna want the department detail as well. So it just makes sense. I don't wanna have to touch it more than once. So that's where I'm at right now. Hopefully, after it's more. That's my hope. Also started working on all of the missing items from the 2024 cost report. So that would be the ED time study, the Medicare bad debt log, all of those things that are not contingent upon an audit being done. So these are things that they need. Flu and influenza, pneumonia, all those kind of vaccines out of the clinic that we get to. Doesn't matter for the audit. We just need those numbers. So we've started working on that so we can get that going. I reached out to Ready Health. They are still doing the market share analysis with all of, we picked 5 surrounding hospitals. What they'll do is they'll go and look at their pricing to help with our pricing. We want to be within the ballpark.
May I ask you which ones you picked? Which 5?
They pick them.
Oh, they picked them.
Yeah, we have, we ask for minimum of 2 costs and 3 like-size hospitals. So we're not competing with rapid, anything like that. So it'll be interesting to see what they come back with.
And I'm assuming that probably means that some prices will raise and some prices will lower.
Typically, but we wanted, so here's what I talked to them about. I said, I want them, the priced accordingly, but I want to net a 3%. So as long as we net a 3%, we are not in violation of our Blue Cross Blue Shield contract. We don't want to ask their permission. So far we're staying pretty good on our cash collection. We can do better and we will do better. We're working on timing. Timing is a concept. They have to realize that everything it needs to be done in a timely fashion in order for us to have it reflect correctly on the financial reports. And yes, it's great that you got all of whatever month posted, but you're 3 months behind in your reconciliations. That doesn't count. It doesn't work. So everything has to be done simultaneously. That is a new process for most of the staff that I'm dealing with, but it will help us make sure that our numbers are accurate and timely. CMS price transparency. We thought we had it done. We created a link on our website. The link was in the wrong spot, so Wendy moved it. When the file was uploaded to the website, it was uploaded into a Excel format instead of a machine readable format, which is the way the report came. So large, they didn't think they we're gonna be able to get it up on the website without changing the format. So what happened was CMS wrote us a little love letter and said, you got 90 days to fix it. We went back, we have to acknowledge the plan of correction or we're in violation, so we did that. Then we went in and I submitted a corrective action plan, which was submitted within the time frame. We told them that we would have everything completely fixed by the 31st of January. Wendy has made all of the adjustments and she is working with the webmaster to make sure that the file is uploaded in the correct format. Realistically, what will happen is if we failed again, they'll just give us another 90 days. But I'd really like to get it off the plate. Since we kind of got it all, I thought we got it all done. So I have been reaching back out to all of the managed care insurance policy people. So we've got the fee schedules. They are going to run on the Medicare fee schedule. So what I've asked them to now give us is what their expected membership will be. Because it doesn't make any sense for us to sign a contract and bid if they got 2 people or no people. So I'm waiting for that data to get back from us. And it's just so we can form how many souls we have to work with. If we sign up for, let's say, Blue Cross Blue Shield, some sort of advantage plan, they're anticipating 400 members the first year.
You talked to us about, like, is that something that you would just?
It's not really something that the board normally does. However, always worth a discussion because it's the rule of thumb is the more insurances we have, the more people. We just want to make sure that we're getting to cover our costs. And that's part of the analysis for each and every insurance policy we contract with.
So is this the same thing? Dr. Reimer, the one that is, that, you know, the sales, yes. Is it the same type of thing as that?
This particular one is. This is Blue Cross Blue Shield's new Medicare type HMO. Their advantage plan. It's not even been washed out yet.
Okay.
So what they're trying to do is they're trying to get hospitals to sign up for it and then go out and say, this hospital is in network, this clinic is in network.
But we're gonna resist that and let some other hospital.
Yeah, I just told her, I go, I'm not willing to do that yet. So what you can do is you can guarantee me so many bodies. So it's just a conversation at this point. Nothing has really been etched in stone. Select Health, I happen to know the vice president of Select Health, so he reached out and said, hey, we're thinking about bumping out a new insurance policy. And I said, that's great. I want 95% of billed charges. He goes, I'll see what we can do because they want to bring this to this area.
I see.
So if that behooves us financially and they can get the members, then it's an advantageous contract. The one thing we need to be very careful of is the reporting requirements. The reporting requirements are too laborious. It doesn't matter how much money we get paid if we have to submit all kinds of data. So it's multi-tiered. So basically what I will do is bring all this information to finance and say, okay, this insurance policy does this. This is our matrix for what they'll do. This one is for this. So it's basically information. Because we can always cancel the contract.
The bad thing is if we cancel it and a bunch of people signed up.
It would be hard to do.
Yeah.
So that's why everything is taken into consideration. Typically, you would maintain that contract for a 1-year period. So the contracts I like have a definitive stop and start, no evergreen. And a drop dead, we can get out of 90 days. So that's how I like to structure my contracts, because if it doesn't work out, I want people to get the facility out of it.
Recently I saw a news story, I did not read it, about potential legislative relief for what's happening with, are you anticipating any positive changes from our perspective?
I don't know yet. I'd like to say I'm not anticipating any positive ones, because they don't seem to be positive for the numbers. And so that just is something that we have to weigh in on, because we want to do and service and take care of our community. So it's not a decision that is made lightly to not accept an insurance policy. So it's not something we'll just do arbitrarily.
Right, oh, sure.
So ADP payroll issues. I thought I had it all fixed until we realized that we were not accruing any payroll. So we went back and started rerunning those. And now the accrual for the salary and the holiday or the PPL pay isn't hitting the general ledger. Back to getting that done, but we have to have payroll and benefits. So it's something that we're going to have to work on. I'm hoping that we'll probably get that resolved next week. It shouldn't be much of a big deal, because it's just the mapping to get it to show up. All the benefits showed up, just no salaries. So we got the majority part of it. So I was plunking around in the system and figured out a way to just arbitrarily delete all of those payrolls without having to do a journal entry to back them out. So I can just go in and delete them when this is fixed. We can turn around and retransmission all the payrolls, and then it'll be done. It'll probably take 2 or 3 days.
Boy, that'd be nice.
So yeah, that's a huge thing. We have successfully received Epic transmissions with the exception of one for the last 60 days. We had one error, and it was GL mapping to an account that I didn't know was in there. And when I went through it, they didn't, it wasn't on the form. So they went back in, I called them up, they made the fix right then and there. Now we're getting 2 posts, one for the hospital billing and one for the professional billing every day.
Mary, what is Epic again?
Epic is our EMR.
It's quite expensive.
Yeah.
Connection with Rapid. Rapid is being our umbrella, but
It's a back on their software and all their clients do. The main hub with the little buckets that surround them. So we haven't gotten very far in accounts receivable as far as the electronic signing. We've had other projects that kind of got in the way of doing that. So we are going to be doing a few more testing. We had the majority of them positively went, they could sign them and we could get them back. There were a few departments that didn't receive them. So Wendy is working with Adobe to figure out why it works 95% of the time and there's 5. So when we get that bug worked out, we'll go ahead and be able to do that. That's why there's a bug. She's not sure why there's a bug, but there's a bug. First, inventory. So the inventory, I met with Swiftly, they gave me the form, the Excel form. I put in all the data, all the pricing, and we're in the process of going through and figuring out why a butterfly bandage is 98 cents and a 3/4 inch Band-Aid is $5. So we're going in and verifying all the pricing. Anything that has an anomaly will be corrected. There are some items that they, that materials had been able to. They think it's because they're all discontinued items, but what I saw were, I can start with all the lab stuff. The lab does their own ordering of that, the inventory, but these are items that you would use in your any-day encounter. So we're going to go down and take a look and make sure that that is accurate before we issue it. Once they get it, they can upload it. They will create the crosswalk of how
This relates to us being able to charge for.
In the meantime, simultaneously, we are creating manual journal entries from every requisition that has been gone on from February 1st of 2024. So Wendy scanned them in, converted them to a Excel. Materials management is adding the pricing. I'm going in, extending everything out, creating the journal entry for the month. So we started this week. We got 1 month done. It was pretty good considering this is a learning curve and there were lots of questions going on. So I think we could probably go ahead and push forward with that. We'll continue that with the training and kind of do everything simultaneously because it's just with different departments that we're dealing with. I'm dealing with the accounting department and payroll, and so everybody's continuing their tasks. So hopefully everything will be done all at once. So getting back to Sage, so the chart of accounts has been updated. I created it. We have all the critical access hospital recommended accounts in there and account numbers. I worked on the 2025 budget, put it in an Excel spreadsheet so we can upload it into Sage. So when we get our financial reports, we will be able to compare to budget. The balance sheet, profit and loss statements, department P&Ls, and any subsequent detailed reports have all been created and approved. I started on the GL crosswalk and got pulled off on another task, so that would be for the auditor. Okay, so what we've got is, and that used up 4.5 hours of my contractor's time. Okay. So we'll continue, but the process we worked out is that I do the grunt work and then he does all the technical stuff. Because that's the stuff I can't be interrupted with to get done correctly. So remotely, and it's nice and quiet. It works really well because I can take my laptop and go home and sit there and go, okay, I want this and this. So it works very well for us. And we're accomplishing things and we're managing to stay under budget, which is a huge bonus. So I went back in and I looked at all the accounts receivable reports. So one of the things I found out, look on the bottom of the first page, it says bad debt, 4.5 million. That is an accumulative number of multiple years. I'm waiting for them to get back to me. When they told me that, I'm like, oh, great. So what am I for this year? Well, I'll have to get back to you. So I opened up a ticket. They will get back to me. Usually takes them about a week or so to get back.
Can I ask a
You can ask
question, please? So does this amount live in our GL? Is the bad debt amount? No.
No, it's not. It's coming totally out of Epic. So it doesn't tie with what I've got in there, so I'm like, okay, so what are my years for it? Because I have a breakdown of 22, 23, and then I've got 24, which is untouched. It hasn't been, I haven't looked at it, I haven't done adjustments with it, because I'm waiting for all the data and everything to be in there before we go in and start playing around with all that. So I think that's probably based on what's in the general ledger. I'm waiting for them to confirm.
Right, so it implies that Epic perhaps talks to the GL, but when we write things off in the GL, it doesn't get back.
It doesn't go backwards. It only goes one direction. So I just thought that was very interesting because I'm looking at the number and I'm hyperventilating going, I don't remember that we wrote off 4.5 million already this year. And so we actually to find that out. So that was really good. The timing things that we were talking about is so notice that claims with open denials is a number. Those should all be worked for the end of the month. So we have a firm grasp on our, that's what we're working on with staff, is we are working on, they will touch all the credit accounts. They will look at any denials. They will reach out, as we started with for home health today. We started reaching out, going, okay, this isn't working, what's going wrong? And working more collaboratively to get those done. Now, we did have to swoop in and reach back out to Epic. Things are not working in Epic still. So we're coming up with a better process. It takes time, but we should be able to go ahead and get that. So we have AR days are 52.4. We were able to actually get down to 49 days. Right after we got all of our cash flows caught up. So we're working with our cash poster, Kim, to make sure that she is no more than 2 days out. So that means when she comes in on Monday, she's got to post anything that came in, and Monday. So we can kind of keep on track. We're stumbling a little bit, but we'll get there. It is a learned process. So the other thing I got to looking at is I said, why do we have 955 claim errors? Is that down and drilling into why these are occurring? Are they software issues? It's this one. Did you find it? There it is. She's got all the paperwork. She got it. I emailed it to her, so she could have it. So we wanted to figure out, so we're picking items off of the report and drilling down into them. So this is our project. This is how we're creating our project list. Last page on the accounts receivable reports is self-pay. I put self-pay on its own page. You can see all those little red numbers at the very bottom of it. Basically what it is that represents the self-pay service credits. When I got here, those service credits were $40,000. They are now $57,000. Have gone up $17,000 in the last 60 days. So what I did was I went, no, that's horrible. Going down. Right. So you know what? Yeah, they're not being worked. And so that comes back to the task. Every credit must be looked at before we close the month. And why is it there? Is it posting error? Okay, we all make mistakes. Did someone post an adjustment and then someone else turned around and posted the adjustment? So we got two adjustments? Fine. We just need to look at our accounts receivable and make sure that it is being managed appropriately. So the biggest one, so patient financial services are self-pay, hospital self-pay. So then we've got medical, we've got what they call patient access. So all of those could be clinic, lab. So urgent care is a bad word. We are not licensed for urgent care. we have put in a ticket for that to say walk-in clinic. So that will be changing. It changed on our side and on the claims, but it hasn't changed on their reporting yet. So I'm hoping that it will in the next 30 days. So we've got MRIs, the outpatient clinic, and the CT. So basically, I wanted to show you the CT scans and the outpatient clinic. Those amounts are co-pays that were posted before the charges were entered. So those will be. That's the kind of knowledge that we need to have. We need to know what's in there, how to work it, what it's going to do, so we can be.
It's nice to have those programs.
Yeah, I just go in and drill down and go, okay, fine. Because otherwise we don't know. I can just look at that number and go, oh, it's getting bigger. Why is it getting bigger? And what can we do about it? So we've tasked them with being a little more timely and committing to work their accounts. Everybody's got a section of the accounts receivable. So we've got to go ahead. As far as the 5-month cash flow, one of the things, the money market, we did put the deposit from the donation because it's a restricted fund. I told, so we've taken almost everybody off that account, but myself, Kathy, and Emma can move money around. No one else can get into that account anymore. So we had to kind of lock it down to get some control over it. But that's where that is. So I know we agreed at a prior meeting several years ago that we wouldn't take anything below the 2 million, but below the 2 million is still part of the donation. So we deposited 501,000 and change, and that $1,000 is a grant for mammos. So we went ahead and put it.
Can I ask a quick question about the security of these funds?
Which funds? The money market?
Yeah, the money market. So, typical civic insurance won't cover a balance this large. Is this all in one bank or?
It's in one bank, but several accounts. And it is insured because it's a money market account.
Right, so we're sure we have enough.
It's there. That was, yeah, one of the, I'm like, well, I thought it was 250,000 we couldn't be over. Now, if they were all in CDs or something, but this is a liquid account.
Right.
So it's in a bunch of other little accounts that we can get to. A CD we couldn't get to without signing it, creating a penalty and everything else. So I'd like to take a deeper look at this, but this is not the highest priority that I have right now.
I just wanted to make sure it was
insured. It's insured, yes. Yep, it's insured. That's all I really cared about. So this is the breakdown. We did receive another 209,000 and plus for our property taxes. We are going to be receiving our more IGT. We got those notifications that we should be getting those within 30 days as well. Before we pay them, it's so thoughtful of them to do that. So, salary and benefits, we need a little work, non-payroll.
That was my question. Do we know really why we creeping back up on the non-payroll?
Yeah. We get this many invoices per week. So the next manager meeting, what I'm in the process of doing is collating in my department, so I ended up doing that spreadsheet I said I wasn't gonna have time to do anyway. So,
thank you.
So we can turn around and we can say, hey, this is how much you bought in the last 30 days. Mm-hmm. Why? That's important. The other piece of that is that we have our materials managers, workers, they're the gatekeepers. So their job is not to just place the order, it's to go out and find it at a cheaper rate. Mm-hmm. One of the things we don't consistently do is run purchases through our GPOs. Everything should get run through our GPO. So that's a learning curve. So we've identified what we need to do, we just haven't got it all implemented yet.
Right. And Ben, I just for your benefit, I asked Tish a similar question, and part of the answer sounded like our aging on our AP has come down just a little bit. In other words, we had some older folks. I think we're down to 31 days about.
Except I just got an invoice from a department from June of last year.
Okay.
Yeah.
So
It doesn't matter if it's December, it's still from June.
So what I asked Tish if she could do, which I've made a list. Tish, you have like 13 different things that you've mentioned. I just made a list of it's what you're doing. And I hesitated to ask, but the non-payroll is a big expense. And so I just asked Tish if our budget has several categories like repairs and utilities and supplies. And if we're going to track all those things in a spreadsheet, could we categorize them to match our budget categories? Just so we can start learning a little bit more about them. And so that is something that we are very
Almost
focused
done
on.
now.
We're very focused on that in finance committee.
Yeah. So, and part of it, that's where we're, part of the reason, maybe I'm wrong, but you're starting to be able to separate stuff out. But it's more of a gut feeling than a it at this point, which is why I had to go and do the spreadsheet anyway. So I've already got the budget piece done. Now we're taking all the actual. Because what happens in the AP system is we assign it a general ledger number, but when we print the report, it doesn't have the general ledger numbers on them. So you have to go in and kind of manually look at them. So I'm sure we can get that fixed. We can customize those reports. I haven't had time to do that. But it was, okay, what department is ordering? And maybe they have a good reason for it. I mean, historically, in January and February, do we see a lot of long-term care patients? Do we have more inpatients because we're seeing pneumonia and influenza? And so I don't know the trending here. I could tell you that if I saw an uptick in these orders, I was going to see an uptick in these kind of patients. I don't have that knowledge here yet. So I have to actually do the paperwork and look at it. So I talk to the department managers with some knowledge so we can have a good exchange of what we're doing.
Yeah, so the ultimate end goal is to learn about where we're spending in our budgeted expenses, so that when we build our budget for the next year, very realistic idea. Once we have a budget, Tish just here isn't on fire all of the time. Then Tish can, every manager of every department will have a monthly budget that says you have this budget this month for these things, and if you go over it, we're going to have to find out why. And
we'll give them a 12-month budget to start with. So, and they will have input on those budgets because we're going to hold them accountable. So what we did this time is I gave out all the budgets by departments at the last managers meeting, so they could get used to looking at those, about what those numbers represent. Because when I finish the financials, all of the department managers will get a P&L via email, and they will be asked what their variance is and why.
Brinkley doesn't play any of those sports, but I know that if she wanted to wrestle or play lacrosse or rugby or something, I would be very glad that she has it to where she could do it with women and not with the men.
Did you see it, Sonia? Blowing up
What's
this
that?
fast and this big? Did you? I mean,
I'm not surprised. I'm not surprised. I know that girls have wanted to have that opportunity to do that. And so, it's daunting to think about wrestling boys, and it's tough when you go into a sport pretty much knowing that there's no way I'm going to win, and to keep at it and keep passionate about it. And so to have your own division where you're wrestling against, women, because like Alexis said, it's biology. The boys are going to be stronger in high school than you are, no matter how good you are.
Part of the learning process.
Any other questions?
I just had, one stat that just absolutely jumped out at me was, I hate to say it, and I know the answer to the story, but the clinic days,
Oh, yeah, they're bad.
that's just ugly.
It is. They were closed for the holidays, so they were closed. I hope I'm not misspeaking. Christmas Eve, Christmas Day, New Year's Eve, New Year's Day.
4 days out of 20 working days.
I think somebody was on vacation.
And Haverly was
He
on
had a
vacation.
2-week vacation.
So that'll
But still
That'll be-
disappointing.
So that'll be a big part of it though, cause
Yeah.
he's one of the.
He sees a lot of patients in the course of the day. Yeah.
I didn't do the numbers, but that's close to a 40% loss, somewhere in that range.
Yes.
And the Upton Clinic, I had a little kid at school that needed to go to the clinic to get his ears looked at. They weren't open because they said the roads were too bad to get there. Now,
When was that?
that was maybe today's Thursday. Now, I know for a fact that pharmacy tech that was in the Upton Clinic lives in Newcastle, and she was at work. I think, and I see that on the clinic door, the hours have been taken off. No hours posted for Monday through Friday. And I know they're usually closed on Thursday.
We're required as a grade C to have our hours posted.
I'm just saying that
I know.
people in Upton get really frustrated because they don't.
Get in the car to go down there, there's no one there.
And we promised to do better.
Yeah.
In those town halls.
And I haven't heard a lot of complaints, but I do know that the mom was kind of frustrated because she had to bring the little one down here.
So she can make it
Come
there.
here, but we can't make it there.
Get there.
Well, and they live here in Newcastle, working up in.
Is there a reason why we don't? I don't know anything about those. So is there?
I
a
don't
reason
know,
why
and maybe I'm blowing it out of proportion, I don't know.
It's
but-
something that we should investigate.
Oh,
So,
Carrie has something.
yes, ma'am.
I just wanted to say we're a hospital. We don't close for weather.
No,
Yeah.
I mean,
I've been told
it,
that's, and,
Understandable if the highway was closed.
right, if it's.
Yeah, the highway is closed, that's a different deal.
I don't mean to stir the pot, I just want fair stuff.
It's nice to have that brought up, because otherwise
They
we don't
should.
know.
Well, I
Right.
don't know.
I don't think
Go back.
Don't, I mean,
They get run.
Oh, no, there's a start.
Now we want to know.
But it's not stirring the pot because we're not, this is the first we're hearing about it. So apparently someone's making a decision
3 blocks.
for the clinics that's probably not their decision to make. And
And honestly, as the board here, I mean, this clinic issue is a big one for me. I mean, this is something I'm gonna keep or think we should all be keeping a close eye on.
And I
Agreed.
agree.
And if you're,
I personally think that an office manager is, or not an office manager, a clinic manager
Yeah,
is
we-
where we need to go.
yeah, and we approved that, so I'll be excited for that.
Yes, I'm looking forward to it.
So historically, in the last 3 fiscal years, we
I
ran
am sorry.
about 855. So yeah, this month is way out of.
Hope my numbers get in my head.
But on happy news, on this second.
if Haverly was gone 2 weeks, that's
Right,
that is
of
big part of
course,
that.
if you're not there, you can't see patients.
also,
Right.
He quit seeing patients the middle of the month.
But he was seeing about 80 a month.
Yeah, but Kathy mentioned to me sometime in the last, well, sometime.
We were supposed to be there soon.
Okay.
We'll just go on with that right now.
Yeah, the clinic needs to be open.
Yes, yeah, that's.
I agree. I agree.
So-
And thank you for bringing it up.
Communities, they're part of our community.
So,
Yeah.
So on the topic of improvements, you'll note we're still taking x-rays at the clinic. And so there's a plan in place that will be implemented sometime soon.
We were supposed to do it this week. But just haven't pushed it.
And so it will,
Kathy said today I could push it, but at this point, I think
you need to let her
I do.
have a break, of course.
So what are you gonna do? Take the x-ray away from clinic?
And so, yeah, our newer machine is $600, and they charge $89. And so it's cannibalizing our imaging department. And then there's a person that is just there kind of all the time who can work here. And so it should be a quality improvement. It should be good for everybody.
Personnel just showing up at a different door to go to work.
Yeah,
Yeah, I think it's gonna be a little more work.
But that's okay, because we didn't pay
She
for
doesn't
all
see that
day.
many people. Well, she's been talked to.
Okay.
She has. It's just a timeline.
that's, I mean, hate to be obvious here, but that means 22 x-rays were done at the clinic with a full-time technician, so not even one a day.
Right.
I wanna work every.
Not even
Yeah,
one
there
a
was
day.
only 20 days.
Oh, so
Yeah,
they're actually 2 on 2 days.
2 on 2
Yeah,
days,
that was the overtime hours.
That makes it better. It's an old machine, it takes 8 hours. Okay. Yes, okay.
The Sunday.
Yeah, I need more coffee.
You're gonna need art refill if you don't call that all that coffee. So are we good? Do we, talk about anything else on this?
On the, yeah.
And could we address the article in the paper? So I just want everybody to know that maybe not the article, but
So so do we address it under finance? Is that
well,
where we address it?
I just would like to let everybody know that that issue, the solution to that issue is that in our accounting system, our supplies have 0 values. So basically everything's free. That's why it's not on the bill. So as soon as those values get in, and everything is in place for people to be billed for supplies. And I asked Tish to make a ballpark estimate of what she thought, what amount are we talking about in a year? And she was thinking maybe 600,000 to 700,000. Now, 20% of our patients are cash pay, and which we wouldn't think we would collect much of those things. So it still will be a meaningful improvement. And so I just wanted to get that out in the public that we know how to fix this problem. We're on it, and we're thinking that it's almost fixed.
So what we're going to do as well as that, so that estimate that I gave you was based on what we currently have in Meditech, which is where they're still using 2 systems, so they're defaulting to Meditech because everything's in Meditech. So those prices do not have a markup.
Right.
They're being charged what we pay. So, yeah, there's no formulary markup, so we're gonna go ahead and do those as far as our charge data master. The whole thing will be done all at once.
So if anybody asks you about the article, I just wanted you to be informed and say, we know about it, we know how to fix it. The fix
It's almost
should be done
fixed. It's
pretty
almost
soon.
Almost as Like, when do we think? I mean, I know you have a lot on your plate, but I'm just,
So I need to go over the missing items from the Meditech versus the Sage inventory. Some of them are discontinued, but we can't discontinue a IV startup or IV bags or tubing or so my husband's a respiratory therapist, so we will not tell him.
You call them breathing things.
Yeah, so all of those need to get looked at because they're not in the other one, and it's not something we would reasonably discontinue.
Oh, yeah.
So it's just missing. So before we get it over there, I want it to be as complete as humanly possible. So I would like to say, depending on what happens tomorrow morning, it could be
just so, again, for the public discussion, the reason this occurred is because something didn't get done previously that should have been done, that was caught by you.
the implementation. It should have been an all-encompassing light switch that got done.
Yes.
So it should have been inventory. It should have been all of the things, historical documentation. And for whatever reason, whether it was monetary, the decision was made not to push it. The machine, it doesn't function without all of the cogs being present. And then you have to troubleshoot. You have to make sure that everybody's talking to everybody else and that the requisition, AP can go in and look at the requisitions and pull them. And they should pull right into AP. So that would save a lot of AP time and the whole system needs to work collaboratively.
And that should have been done initially, it was not done, that's why we're finding some problem, that's where we're at.
So that's why we're paying catch up right now.
Yes. I just want to make sure publicly making that known.
Yeah.
This isn't a problem caused just in the last little while or something like this.
No, it was just part of an implementation that
Happened.
Did not get
happened.
I haven't had a chance to even look at the paper, but
Previous administrator.
but that $3 million figure is not a year deal or a 2-year deal. It's
I'm not,
possibly a 5-year deal, but I'm sure that's not explained in the paper. But I haven't read the paper.
I'm not really sure where that value comes from, but it's going to be fixed very soon. So it will be a problem that's behind us.
Yeah, it should be behind.
Kind of hard to get donations
'Cause I
when
can't
you-
do
articles like that come out. in the paper.
Financials, yeah. Well,
So Bob,
so
I actually met with him, Charlotte, stayed there Wednesday for about an hour. So it's actually a really good conversation. Guys that coming on. Strides, relationships were good. Sharing about marketing and stuff, things that could help the hospital. And, you know,
The article does attribute these issues to the previous administrator and the way it was implemented. So that is accurately reflected.
there will be another story I think will come out next week. He did tell me about that. All of the minutes of the board meetings have been pulled and looked at, and they're reviewing the commissioners and all the public, the school board. I guess we got the highest percentage of time in executive session. Sign minutes and stuff, so it's gonna be some of that stuff. As we do know, there's a lot of housework keeping that has not been done on that side. And we are trying to rectify and of course, move forward, doing very different.
And Bob has expressed his concern in the past, I think it was this summer, maybe about July, that, you know, you guys need to make sure you're following the rules for executive session and so forth, and I think we are, but so he's right to be concerned. Can we run a press release in the paper when the inventory finally is fixed and working, just to let everybody know it's working now? And
also with full executive session, we have to remember that we are a hospital, and with all the HIPAA things, and there is a reason why, I mean, besides the fact that we are long-winded in general, and, you know, but, I mean, and I'm not pointing any, I'm just, we as a board we talk a lot, and so that's why our executive thing goes, and I'm not growling about that at all, but we are a hospital, and we do have things that have to be. And
I do think.
And I hope Bob realizes
You
that.
got it, Chairman Terry.
Oh, sorry, Carrie.
So just to add to what you had to say, I don't think that we have done anything wrong when we go into executive session. Like you said, there's patients involved and all of that. I think we have always tried to be as open as we possibly can, but we're all human beings and we can all get better. So I know in the past, Bob did a board training like before one of our meetings where he educated everyone about the open meeting laws and when you can go into executive session, and that it might be very nice to invite him back for a refresher. If everyone's willing to come in at 5 one day. It was very informative to me. And like I said, I'm always trying to be better and my brain sometimes is small. So it would help to me to be a refresher as well. It might be a nice thing to invite him back for a refresher.
Madam Chair, I think we have legal advice. I think we're going into a board training. They are professionals. Mr. Bonner, I may be on the point of wanting to teach you what he wants you to know. And that's my comment on that. I have no problem listening to anybody, but also at the same time, we do have legal advice. We've never gone into the executive session. If we got off track slightly, legal advice has stopped us and put us back on track. But if we're going to have a training, we need to have training from somebody that has training to give that training.
And I'd like to, I don't think you can compare board against board and different situations against this hospital board. There's issues here that are extreme compared to what I'm sure other boards are going through. And we knew that up front, and all of us. So I think the time we spend can't be compared to any other board. And say you're doing too much of this.
And the newspaper is chronicling those sorts of issues that we have with
major changes in the last 6 months.
Yes.
Right. You know, and I agree. I get a little long-winded.
Well,
I will point it at myself, and
we all do.
And maybe executive sessions by me saying everything.
Except Mary.
Yeah.
She's a lot more,
Mary
more
is
concise than
so
the rest of us.
noisy over here. I gotta say everything at least 3 times.
I really want us, I don't think we want to I think in the long run, we are better off if we let one another talk. And whether that's outside of executive session or inside.
Both with needed.
Yeah. Sort of way. And but it'd also be good for you guys to help me keep us on track. That's what I'm not particularly good at that. So anyway,
just a heads up.
I definitely feel that we make better decisions together.
I do too. I agree.
Okay, where are we at?
Down just a little bit.
Shane's up.
Okay.
No, you're better.
So December was a stable month for us. We averaged 40 in December. We had 2 admissions, 2 discharges. These are great numbers. We admitted 2 this week. We're admitting 1 next week. We're admitting 2 the week after that. And another one coming in first week of February. We have a tour this Friday, and then we have 2 other ones happening.
And how many?
49.
So in
49 and moving is the way.
right.
and do we do we have the staffing and everything in place, do you think?
We are right now staffed for 46, 47, so.
So, yeah.
Having a couple more, yeah, we can do this, so. I think that's been a lot of it.
Part of that is just changing the, not having a waiting list or.
Yeah, we've been having some of that, but then we also, and with all of this. I think it's a combination of a lot of stuff, but yeah, I know I've been around on a couple conversations where staff was stopped themselves, so they started to see what was in this up to movement that's available immediately, so I think that's definitely helpful. As for staffing, we still have the 4 full-time. I hired last month, fell through, never heard back from them, so. We have hired one PRN, she started last week, and we have 2 CNAs that have been registered. That's their tests, so. Hopefully that keeps improving, so.
Is that the ones, cause didn't you just have a training?
Yep.
A CNA training,
Yeah,
so that's.
one of them just being done.
Yes, please just keep her there, yeah.
Yeah, and with
Carrie, did you have something?
No.
How that's coming along.
so again,
So we will talk about some of that.
Okay.
I believe that's what Kathy and I talked about before.
Correct. I can share that we are working towards a couple of staff it fully. Total of 5. 1 is on FMLA, so 4 open house. So down there, then we'll that's experience. We have a part-time application that we're evaluating. So yeah, it's a lot of work. It's been very volatile in the kitchen because there's a lot of different personalities. It's not everything where everybody's trying to figure out where to go. I have found though that being present and being there with them, a whole lot better since I've started watching this. Stop. License we have. I can't promise 30 days, 12 days, 2 days, 2 hours. I'd like to do it tomorrow. But we did have another full-time staff, hiring always that was had two hired with offers, but they fell before Christmas, and then Christmas, New Year's. That caused a little frustration in the kitchen. Rather outside. Plan. We're working through it. We got applications. We'll have some difficult conversations that probably. Stuff. They've been listening. Not as fast as I like, but we are.
Thank you. I just want to thank you for what
Yes.
you've been doing in there. It's amazing, honestly.
We'll just have to, then we were able to put on. Tuesday, and then the pizza barn, Pam, we're thankful for her. She's my was on into the staff today. We're going to use another staff member, Letty, who works on the we're coming up with some creative in here. Let's use our extra stock. People, and the residency, you know, we had some issues. So, again. I just want to make I'm not sure if this is the right time to do it, but I would, getting the MANA report is so important, and I get so much from that understanding. I think going forward, when we do have the clinic lined out and a manager, I think it's going to be critical that clinic manager comes over here and does the same thing the manager is doing.
Oh, yeah.
So I just wanted to make sure that we get that onto the list, so we can ask questions directly.
Okay, thank you, Shane. So the whole thing so I talked to Kathy today, and it sounds like her mom's funeral is gonna be on Tuesday. So she still wasn't sure yet when she'd be coming back, but I know at least it will be after Tuesday.
It will be this coming week.
So I asked her about the whole interim, the policy as far as the interim CEO goes, and she said that it's her state words are getting all turned around, state regulation, that if the CEO leaves the state, she needs to put somebody in charge. And so it's a normal practice is that it be the CFO. That was how she
Hierarchy.
Yeah.
But in order, saying that, we do really govern by committee.
Right, that's what it seems like. The three of you are working together.
Yeah. So it's more of a collaborative effort than it's just, I just get the final say.
Yeah. Sort of,
not always,
right.
But we do, and it is more collaborative on how we want to proceed, because we've all had with ourselves, we meet daily, sometimes several times a day, and
then Tony sent me this read it to you guys, so that I'm clear, or that, anyway, so he said, this was Tuesday that he sent this, and, he said, "Hi, Ann, hope this note finds you well. I want to confirm how much time we'll have for board training on February 19th and 20th. I'm hoping for a minimum of 1 4-hour block, but would also like to suggest possibly doing 2 3-hour sessions, one for each day, for a total of 6 hours. Please let me know how much I can have and I will scale accordingly. Also, I'll be ordering a book on governance leadership, as a pre-read before the training, just a heads up." And then I said, okay, well, I would talk to everybody. And he's like, oh no, just talk about it at the board meeting and let me know by the end of the week. So I was happy for that. But so what do you guys think? Are you guys willing to do 2 days, 3 hours each?
What days are we looking at?
Wednesday the 19th and Thursday the 20th. Or just do the 20th was the one we talked about, the Thursday.
What time of day?
Yeah, it would be afternoon. I don't know what he's thinking, but we would do it in the afternoon. And back.
So is there a quality meeting on the 19th?
Probably.
4 o'clock, and the 20th is actually a trust.
Yeah.
We were thinking before the.
Yeah, there will be a quality meeting at 4. It's
Talk
usually
to
at
us,
4.
Mary.
I'm just.
You have school.
Well, I have a 7th grade health science class from 3 to 4, 4 days a week. Now, if I can go out far enough, and I know for sure we're gonna do it on the 19th and the 20th, I'll either have those little darlings go to somewhere else, or I'll just keep them at the middle school. But I'm gonna have to figure that out. But is it for sure the 19th and 20th?
It's for sure the 20th.
Okay.
And then we have to decide right now whether we want to whether we just want 1 4-hour time, or whether we want 1
2
3 hours.
3-hour times.
What would you think if we, let's say the 3-hour times, we want that one,
And the
are you
20th
looking
is
from
The
2
20th
to
is
5?
the board meeting. Yes.
Yeah, I think we would decide together what the best.
Yes,
time is.
well, somebody's gotta throw something out.
Right.
And then if we went with 1 4-hour,
That would be on Thursday.
Thursday
and
before our
just
meeting.
Before our meeting.
So
Hopefully
we
give
could
us
do from 1 to 5, give us a half an hour break. Well, maybe we'd learn to go home. Yeah. No,
Right. So,
I'm a firm believer in board training.
Mhm.
I don't think it hurts anybody.
right. So I think we just need to decide what we want to do.
I can do either. I'm open to either.
It would be easier for me, I'm being selfish, but it would be easier for me to have 1 day instead of 2. That way I only have to
Arrange
send my little darlings somewhere else for 1
1
day.
day. Yes.
Would 1 to 5 work for you?
I would just I've got a doctor's appointment that morning in Gillette, so I would just take the day. And I would get a substitute and
I could more easily accommodate just the 4 hours on Thursday.
Okay, it would be easier.
And for 1 4-hour. So then the other question is, I think we need to decide. Carrie, what about you?
I agree with Mary. 1 day is always better than 2.
Okay. So, so then the other question is do we want to start at noon and go to 4, or start at 12:30 and go to 4:30 and give us at least an hour break between the meetings?
We get supper here.
Yes, I'm just thinking.
I have an appointment in Gillette at 10.
Yeah, okay.
Oh.
But maybe I can get that changed. Maybe I can get that changed. I'll
Well,
try.
we're asking you to do a lot of things, a
Yeah.
lot of changing.
No.
I would
No.
rather go, for me, 1 to
It works better because then you can get your work done in the morning.
Yeah, I've got my time is consolidated in one block. If I get an hour away, well then, okay, what, I can't do anything in an hour.
Right, yeah, that is exactly what my husband would say. Just, get it all together, and I'm like, whoa, I can't think, but we can make that work.
Okay, so one to five.
1 to 5.
On the 20th, right?
Okay, I will report that to Tony and figure out how to get books to you guys.
Can we put that on the schedule as solid?
Put that on the schedule, solid, 1 to 5, with a half-hour break in the middle.
So is that gonna be here in the boardroom?
At one point Kathy said she wanted us to do it somewhere else.
At the lodge,
Yeah. Right, but we'll figure that out.
We have a meeting room upstairs in the lot. Maybe slightly larger than this, but not much.
Yeah, it's wider, but that's about
I
it.
think the thought was to do it outside.
I mean, at one, you don't have to have one.
We could just do snacks, a snack in the middle.
Yeah, fruit.
Fruit. Snack in the middle.
Fruit is good.
That's a good idea.
With a little chocolate.
Oh, with chocolate, yeah.
Don't forget the coffee.
Fruit and chocolate and coffee. We all have our.
Coffee works. Just don't go all out. 'Cause that will, and that, between 5 and 5:30, that will give us an opportunity to eat supper.
You guys just get trained and we'll take care of the arrangement.
Okay, but just, you know,
I'm pretty sure.
especially if you're still in
Half an hour of that.
Yeah, and I've got-
We can just make sure you're in
Yeah.
Okay, so if everybody else is willing, I am ready. I think we should move into executive. Is there any other, do we need to take another few minute break or?
I wouldn't hurt to take a little bit of break before we take executive.
Okay, so,
Some of us went for the food, didn't go to the bathroom.
so so we'll pause the recording for just a few minutes, but then we'll turn it back on, go into executive and
Turn it back off.
turn it back off. Is that okay?
And-
Carrie?
Could you, would you try and call me on your cell phone? Because I can hear like every eighth word. And when John spoke, I have no idea what he said, but he made a lot of gestures. So I made up my own story. But I want to try this cell phone because I can't hear anything.
Okay, so.
It's really hard for me too.
Yeah.
So I don't know how to share, I don't know how to get both of you, Allison, on the
I can
same
help
phone.
you.
Okay, so Kareem will help me try to get you both. Carrie, is it your same 806 phone number?
No. Can you dial 307 312 0768?
Okay.
Allison, my question is if you're gonna go this route,
Do you have Allison's?
I still should move forward in the rooms and all the other.
Well, if you're gonna keep the Zoom video on, we should, so that we're not broadcasting the video in case somebody jumps on.
Okay.
The video
Thank
is
you.
helpful.
It is.
At least I know who's speaking.
Yeah.
I don't know what they're saying, but I know they're speaking.
So we'll get you two called here.
Do you guys want 5 minutes and then we'll call you?
Sure. Thank you.
Thank you.
Okay, so who wants to move that we move into executive session?
I did it last time.
I'll make, oh, you have to read that thing.
Yeah, I have to read the.
I'll do it again. I move, we go into executive session under Wyoming statute 16-4-405A2 to consider the appointment, employment, right to practice or dismissal of a public officer, professional person or employee, or to hear complaints or charges brought against an employee, professional person or officer, and 9, to consider or receive any information classified as confidential by law, including legal advice. I second.
Okay, all those in favor say aye.
Aye.
All those opposed, the same. We are in executive session.
Go ahead.
So do we have to come into regular session?
Probably if you want it recorded.
Okay, so,
Is it recording?
so we're moving into regular session. I wanted we wanted to make the point that we were very happy and pleased to see the teamwork and how well JT and Tish and Shane are working together and making good decisions and leading in the midst of a crisis.
And that we're very grateful to have you all here and grateful to see the teamwork and everybody working very hard. We're grateful.
So,
Very much so.
yes, I would entertain a motion to adjourn.
Madam Chair, I move that we adjourn.
Okay, a second.
I'll second.
Okay. All those in favor of adjourning, say aye.
Aye.
All those opposed, same. Okay, very good. Thank you. We are.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.